Recently, I held a Medicaid listening session in Denver to hear from my constituents about how Medicaid influences their lives and how important it is for them to get the health care that they need. In Congress, Republicans are talking about slashing Medicaid for millions of Americans, which could lead to them having no insurance and no health care. So I had this session. I had over 50 people come, providers, patients, and people who told me that they literally could not have the life-saving health care they needed if they didn't have Medicaid. And so I put together some of their stories in this tape, and I think it's worth everybody listening to why it's so important that we preserve Medicaid.
Hi, my name is Emma Clark. I'm very grateful for Medicaid for the coverage it provides my son, who has had a heart transplant and is HIV positive. He's on a number of medications. But further, I live on Social Security and I do have Medicare, but I can't afford the coverage for the copays and whatnot. But if Medicaid is cut in any way, my son and I are both out. I'll lose my home and he will probably die. I don't know how else to say it.
My name is Jason. I have HIV and I had a heart transplant. I also have ADHD and depression. So without Medicaid, I would die. I would already be dead, in fact. So I think it's important just to spread the word that how important the Medicaid is to so many of us. A lot of us would die without it.
My name is Lauren Hunter. Medicaid is important to me because it is the only reason I am able to work. It's the only reason I am able to be a full-time student. And Medicaid is the only thing that protects me and others from not receiving the health care that they deserve and need.
Hi, my name is Lindsay, and I'm just here to talk about how Medicaid is important to me. So I've been going to doctors for chronic pain to try to figure out what was going on for 10 years, and they figured out finally in November that I have hip dysplasia with arthritis in both hips, and I need a surgery to fix it within 6 months to a year, so like that from November, to fix it to prevent a total hip replacement. I also have my cartilages breaking down, and it's gotten progressively worse. And also I have an autoimmune disease, which I need access to my doctor and meds. If I don't have access to my meds and doctor, there are life-threatening things that can happen. For example, cancer, heart disease. It opens the door also to other autoimmune diseases, and stuff like that. I really, really need Medicaid. It's life-saving for me. It's a lifeline.
Hi, I'm Tom Strobel. I represent ME Action Colorado. That's a group that advocates for those with chronic fatigue syndrome. Most of these people are very sick. They've got, a large percentage of them are housebound, even bedbound, and a greater percentage of them can't work. They are very, very dependent on Medicaid. Without Medicaid, they would be in very dire straits. There's probably somewhere between 18 and 48,000 people with ME in some regards in Colorado. I'm very, very concerned what they would do without the Medicaid, because the Medicaid helps them in so many different ways in terms of taking care of their kids, taking care of themselves and paying for medication, and taking care of medical costs in regards to healthcare providers. I'm very concerned about it, and I hope that this does not come to pass the way it looks like it will come to pass.
I'm the senior Democrat on the committee that will be considering this legislation, and I will fight with every fiber of my being to make sure we preserve Medicaid and health care for all Americans.